According to Medicare records, routine care in the USA is around $150 a day. Inpatient care around $700 a day, and continuous care around $900 a day. So it should come as no surprise that a temptation exists for patients to be reclassified wherever possible to maximize revenue for hospital operators. One medical support area which may be open to abuse is that of hospices. Hospices exist to provide comfort and compassion to people who doctors determine are dying, usually those with 6 months or less to live. Around the turn of the century, the US hospice industry underwent major change, from that of being a small, segmented industry, often run as a non-profit organisation, to what is today a booming $25 billion a year industry dominated by national chains. Around half of all Medicare patients who die now do so within a hospice environment, twice as many as in 2000, government data shows. The business has attracted the most unsavoury of workers on the fringe of medicine, marketers connected with hospices who pervade clinics, hospitals, rehabilitation centres, geriatric units, old people's homes, and other suitable targets in order to sign up the last gaspers, patients who have a short lifespan left to them. Marketers tend to avoid the physician treating the patient and instead talk to hospital management, emphasising the financial benefit to the hospital. Often they achieve this by citing a provision in the 2010 healthcare law which imposes penalties on hospitals when patients are discharged, then readmitted within a 30-day period. Hospice marketers often use aggressive tactics and have been observed scuffling with each other in hospital corridors over the right to sign up dying people. Some have been known to pry into confidential patient information to assess a patient's life expectancy. Hospices are generally less medically equipped than hospitals. This is because the role of hospices is different from that of hospitals. Hospices relieve pain, provide comfort and support. Theirs is not an environment for curing people. Their job is to assist patients who are entering the death process and make the transition from life to death as comfortable as possible. Medicare rules require that doctors certify that hospice patients are likely to die within 6 months. Consequently, if a patient is admitted to hospice care who may very well be sick but not dying, then any emergency which may occur may lead to a denial of service, because the hospice is not equipped to provide the sort of care available in acute care settings. Such patients may be at risk of premature death or suffering needlessly the complications of a treatable disease. Should a patient who is not at the end of life be erroneously admitted to hospice and then suffer some new acute problem, that patient is also at risk of bad outcomes, including death, because of denial of the sort of care available in acute care settings. Thus, admitting patients to hospice that are not at the end of their life or have not given truly informed consent for hospice care may be injurious to their health. In 2014, the New York Times reported that the Justice Department had joined 8 separate whistleblower lawsuits in 6 states against Health Management Associates, HMA, whose headquarters were in Florida. The lawsuits allege HMA attempted to inflate revenue from Medicare and Medicaid by admitting patients who were not sick, including an infant whose temperature was a normal 98.7 degrees for a fever. According to one whistleblower, lawsuit physicians were instructed to admit at least half of all the patients they saw. Physicians who did not comply were terminated. That's a report from Julie Cresswell and Reed Abelson, January 23, 2014, the New York Times Business Day. HMA owned or run at a time various hospitals, such as the Charlotte Regional Medical Center, a 200-plus bed general hospital located in the city of Punta Gorda, Florida, the Lake Norman Regional Medical Center, a 123-bed hospital, the Santa Rosa Medical Center, a 129-bed general hospital located in the city of Milton, Florida, which is the primary provider of hospital-based healthcare services and emergency medicine in Santa Rosa County, Florida. The Sparks Health System, a 274 general medical and surgical hospital located in the city of Fort Smith, Arkansas. The question is, why did a seemingly successful hospital operator such as HMA Florida, then listed on the New York Stock Exchange as such, stand accused of inflating revenue? The answer appears to be that the whole system was run as a business and controlled by accountants with cutting-edge software who are acting for corporate interests. The New York Times article I cited indicates that medical practice is controlled by corporate interests rather than decision-making by individual doctors in such a case. This may be a worrying evolution of patient care, because the question arises as to whether corporate interests have the same ethical constraints as medical practitioners, or is the bottom line a determinant in patient management? On September 25, 2018, Health Management Associates LLC, HMA, a subsidiary of Community Health Systems Incorporated, agreed to pay more than $260 million to settle whistleblower lawsuits alleging wide-ranging misconduct in emergency rooms, including $62.5 million to resolve allegations that HMA forced physicians to make unnecessary admissions to its hospitals. The United States Department of Justice joined the whistleblower lawsuits filed in federal courts throughout the country. Please hit the subscribe button if you want to continue the myths, to dispel the myths surrounding medicine. It's a little image of a Neanderthal on the bottom right of your screen. Also, please indicate whether you like or dislike this video.